The Victorian Premier Daniel Andrews is giving his state's COVID update.
23 cases, they're all locally acquired. That takes us to a total of 4,038 active cases across Victoria. 149 of today's cases are linked. The rest are being investigated by our public health team. Sadly, we have to announce and confirm that there have been 2 deaths, a man in his 40s from the Whittlesea area and a second man in his 70s from Wyndham. And we extend our deepest sympathies and condolences, and we extend those sympathies to their families and indeed to all of their friends, and they're in our hearts, our thoughts and prayers today. 84% of all our cases are under the age of 50 and 1/4 are in their 20s. So this is going where the vaccines aren't. This is going to that unvaccinated, that is a pandemic of the unvaccinated. That group is still a very large group. It is getting smaller by the day though, and that's why it's so pleasing to be able to report that we have surpassed the 1 million vaccines, 1 million doses in 5 weeks. We're a couple of days ahead of target, and I thank each and every one of those Victorians who've gone through state hubs. That's 1 million jabs over less than 5 weeks. As we had indicated our target 1 million, we've reached that, we've exceeded it. Thank you so much to all of those who have come forward and got vaccinated. You're playing a massive part in keeping yourself and the rest of the community safe, avoiding serious illness, getting us opened up, getting us back to normal and getting us the freedoms that we all value and cherish and desperately want, perhaps more now than ever. There are 173 people that are in hospital, 44 are in ICU, 23 are on a ventilator. We send our best wishes to all of those patients, and we send our thanks again to the teams of dedicated professionals who are caring for them. Our challenge is, as a community, not to make the work of those dedicated professionals any harder than it already is. We know there are going to be more cases. We know there are going to be more people in hospital. That's an inevitable consequence of delivering the national plan, a plan that we help write, a plan that we are faithful to, a plan that we want to deliver in its entirety, and we will. But that is predicated on the notion of getting to a point where we have to open up, and that will see an inevitable increase in cases, an inevitable increase in hospitalizations, and that'll mean the work of our nurses and others will be hard, very, very hard work. It is every day in many respects. We just have to get the vaccination numbers up as high as possible before we open up. Again, all countenanced, all clearly outlined in the national plan. Otherwise, it's not really a fair fight. We can manage, although it will be tough, a pandemic of the unvaccinated if that unvaccinated group is as small as possible. We're not yet at 50% double dose. The notion of opening up now is not only irresponsible, it is dangerous. It is not what the national plan calls for, and it is not what our government will do. Any suggestion to the contrary, well, that's not in the national plan. Far from it. It is wildly variant from the national plan, dangerously so.